Hello, my name is Dr. Dennis Courtney. I am the medical director of the Pittsburgh Eye Protocol. You may, in fact, be suffering from such diseases. You've heard of them before. They're things like glaucoma and macular degeneration and diabetic retinopathy. If you don't suffer from these disorders on your own, maybe you have a loved one or an acquaintance that does. Unfortunately, if you suffer from any of these diseases or any of the retinal diseases, you've been told that absolutely nothing can be done to correct that. Well, we'd like to show you how, in fact, that is not true, that these visual disturbances can be corrected, and we want to thank you for taking the opportunity to learn more about our three-step approach to restore your lost vision. We're going to take some time to describe in detail how the three-step program works. We'll take some time also to describe why it is that your doctor really can't help you, and because of the tools that he uses, won't be able to help you, when in fact you thought that all was lost and nothing was ever going to be found to do just that. So we're going to take some time now and move to a group of slides prepared to allow me to sort of bring you along gradually on this journey to describe our three-step program and give you the opportunity at the end to enroll in our program. So let's get started. The title of our talk today happens to be the name of my book, which is entitled Restore Your Lost Vision Now, the three-step program to regain your sight. A little later on, I'll be telling you how to get a copy of the book, but for now, let's just allow you to sit back and enjoy the presentation, and we will be mentioning specific elements of the book throughout this entire webinar. I'll also be telling you about how to take charge of your current vision problem by becoming a participant in one of our 3-day programs, which are held monthly in our offices, or at least how to get started immediately to regain your lost vision. So with that said now, let's move on and talk about things that you may have been told. You know, I'm sure that many of you listening and watching right now are afflicted with some pretty serious eye diseases. Some of the worst of the worst. They're all in this category, you know, of retinal diseases. When something goes wrong with the retina of the eye, you can rest assured the conventional medical community is going to have one unfortunate story to tell you, and that story will be that nothing can be done. You may have heard this already from your doctor. Unfortunately, it doesn't feel very good each and every time that you do hear it. You're told just to live with your poor vision. And as much as you depend on your independence, the fact that you may have to give up your driver's license also looms large out there, and you can foresee just maybe a time in the future where you may have to do that. And it's very disheartening with that threat looming over top of you. So let me tell you a little bit about myself. I am a medical doctor, of course, and actually medicine is my 5th fully actualized career. So there have been quite a few careers in my lifetime. They've been all enjoyable. But this all started with me as a high school teacher back in the suburbs of Western Pennsylvania. Ultimately, I did go on to become that anesthesiologist in the medical profession and worked inside of the operating rooms for multiple years doing what anesthesiologists do. However, I moved outside the operating room and into an office practice, and that office practice has now been in play for the past 20 years. It's a completely different office practice than I was trained to conduct in my medical training. Yes, I am a homeopath and a naturopath. I am the past clinical director of an anesthesia department. I have created and developed the Courtney 3-step program and written the book by the same name. I've also hosted a radio show 3 times a week in my market for the last 23 years. The Courtney 3-step program to regain your sight has evolved over the last decade due to the number of individual treatment programs that I've been involved with in my office. The results of patients who have participated in the programs have been miraculous. And it's safe to say, and I'll mention it many times during this particular webinar, that 85 to 90% of those patients that have been involved in the 3-day program have a substantial improvement in their vision after the 3 days. Now, these same patients who have been involved in the 3-day program were told by their eye doctors that nothing could be done. Will you take control of your medical situation or await to becoming another statistic?
We're going to examine the Courtney 3-step program and take a look at those steps and show you in simplified terms what they entail. I think you might be rather surprised on how doable this program actually is. The first thing I want to make certain that I clarify is that this phrase is not even allowed to be uttered in my office by any patient, and I counsel all patients in telling them not to allow it to be spoken anywhere in their presence. I am tired of hearing that nothing can be done. And in fact, nothing can be done when it comes to serious eye diseases. In particular, these retinal diseases is an absolute fallacy. I want to emphasize that over again. So don't allow people to tell you, even your doctor to tell you, that nothing can be done. Better to learn how it is that actually something will be done, and that's what our seminar is about today. You see, there are limits to conventional treatment. The reason why there are limits is because of the tools that are used within the profession. Folks, there are only 3 things used by the conventional medical community. These are my colleagues. I understand their training. I have been trained in the same system and approach to treating disease. There are only 3 ways to do it. You either use drugs, you do procedures, or you do surgery. As it turns out, there are some great and wonderful things that can be done in utilizing one or combinations of those 3, but there are limitations to the use of all 3 in certain conditions, and the retinal eye diseases are those conditions. Conventional medicine works in a disadvantage, and here is that disadvantage. Conventional medicine is trained and honed to combat disease. All of the efforts used by the brilliant participants who are your medical doctors are focused on eradicating a disease. And folks, I'm here to tell you, you can't combat a disease and win. You will lose every time. The forces of the disease are so strong and they're so powerful that you will not be able to whittle away at them by attempting to reverse the disease alone. Let's take another look from a different perspective. Integrative medicine, the kind of medicine that I've been practicing for over 20 years, uses all of our efforts to do something completely foreign to the conventional medical community, which is to reestablish health. Folks, this is the only way to conquer disease. And as you will find out, you can beat a disease by reestablishing health. We are doing it every day, and it is the basis of the foundation of the 3-step program. Now you, who maybe are feeling a little strange right now, thinking, geez, I wonder what these 3 steps are. I wonder what this doctor means by talking about how you beat a disease by approaching it from a health standpoint, it's going to require a paradigm shift on your part, because you may have never thought the way that I want you to begin thinking. It is going to require a paradigm shift, but that paradigm shift is deserved to be taken because the direction that you're going is completely out of control. And your eye situation is destined to get nothing but worse tomorrow, even a little more worse than it is today, until that shift occurs. There are going to be 3 steps, and 3 steps only, to your vision restoration. It is the basis and the foundation of our program here to instill those 3 steps in your mind, and we're going to be talking about those 3 steps in just a moment. Let's look at these, folks. These are the offenders. These are the vision stealers. These are the eye robbers. And if you suffer from any one of them, you already know the gloom and doom that has been projected by your medical doctor with respect to each and every one of them. Things like macular degeneration, glaucoma, diabetic retinopathy, retinitis pigmentosa, macular hole, optic neuritis, Stargardt's. The list is even more lengthy than that. They're all commonly linked in that they are all retinal. And when there is a problem at the retina, using the tools of the conventional medical doctor will not be able to restore your vision. And this is why you have been told that nothing can be done. But of course, you're no longer going to allow that phrase to be used in your presence ever again.
Ladies and gentlemen, here is the Courtney 3-step program. Step number 1, correct deficiencies. Step number 2, remove all toxicities. And step 3, optimize perfusion. Now, they don't appear to be all that difficult, do they? Every one of these steps is conquerable by you if you could just be shown how to do so. Now, as I've already mentioned, that first profession of mine as a teacher has carried me in good stead for a number of years. I do have a knack for being able to take very difficult concepts and simplifying them to such an extent they become easily remembered and understood. So once those complexities have been removed, we are left with these following 3 memorable steps. I think that you can see that you can do this. And that, of course, is exactly what I want you to see. So we're going to be talking about step 1 in specifics on correcting your deficiencies and why you really do need to do so. Step 2, we'll also be talking about how to remove all toxicities and why you need to do so. And step number 3. And then finally going to talk about the most frequently missed component in correcting disease, and that is establishing and optimizing your perfusion. Now, don't allow that term frighten you or confuse you. I promise I will explain it to you fully and what is meant by it.
So let's talk about step 1. Step 1 is to correct all of your deficiencies. Now, folks, the diseases of the retina are, for the most part, the diseases of advancing age. After all, there aren't many 20 and 25-year-olds that are afflicted with glaucoma. There aren't many 25-year-olds with diabetic retinopathy or with macular degeneration, whether that form is wet or dry. These are diseases of advancing age. And what we have here is all of your deficiencies of a lifetime. And folks, you have accrued many deficiencies. Your diet was what your diet was. your likes and dislikes of food became what they became. The nutrients that you had in plentiful amounts, you got plenty of. The nutrients that weren't in your foods, you were absent of. But over the course of many, many years, here's the unfortunate reality. You've been able to slip by for many years without paying the price for those deficiencies. But unfortunately, before it's time to leave this good earth, your deficiency states are going to provoke the diseases of advancing age. And it's one of the reasons why you're suffering from macular degeneration right now, or glaucoma right now. Your deficiencies have brought you here, and they will need to be corrected, and they can be corrected, and will get you established on that way to achieving optimal health. We're going to optimize your diet. I'm going to tell you that probably the easiest way to do that is you need to start eating organic. We'll talk about how to select the foods, how to make that diet really an unharmful diet, because I believe that the diet that you take has the potential to cause harm. But as you're going to see now, I'm going to make a statement that may sound a little bit unbelievable. But the statement is, you can't eat your way to health. If you changed your diet today and you began to eat very nutritiously, there unfortunately isn't even enough nutrients in the soil that are transmitted to your foods in order to get you out of the ditch of deficiencies. So the diet absolutely needs to be changed around. And we want your diet to be composed of healthy things, but it's more important to make certain that you don't consume anything to harm you any further, and not allow and even think that you can allow your diet alone to get you out of the jam that got you here. It'll be sensible supplementation that does that, folks. You're going to require vitamins, mineral, herbs, and other substances that your body has lacked over a lifetime. We can get you back to neutral once again and resolve all your deficiencies through a diet, essentially organic and even raw. But with sensible supplementation, these two will be able to correct the issue of your deficiency states. Let's move on. Step number 2, remove all toxicities. Folks, wherever you live, whatever part of the country that is, whatever your profession may have been, whatever municipality you live in, and the intricacies of your municipality and location that bring toxicities to the table with you, you have soaked up these toxic substances throughout your lifetime. They are in such abundance now as you have moved into advancing years that tissue may even like to work, but it just can't, because the toxic substances that have been accumulating within those tissues won't allow them to work properly. So, in almost a contrary way of correcting your deficiencies, we will have to remove all of your toxicities and get cells to be unburdened once again to be able to function normally. Now, there's essentially 2 categories of toxic agents. One, the very famous category of heavy metals. You are all overburdened with heavy metal toxicity. We'll need to find out which metals they are, and we'll need to get rid of those metals. And in fact, we will. There's also a completely other toxic burden of non-heavy metals, equally as cumbersome, equally as oppressive to the normal functioning of tissue, and it has played a major role in your eye disease of today. Just as your diet and the deficiencies of it have led to you developing your MACD, or your glaucoma, or your diabetic retinopathy, so too the accumulation of these toxic agents over a lifetime have also finally gotten to a point that they have provoked and allowed these diseases to take footing, to take a hold, and until those tissues are unburdened, you can't have those tissues function again. But the fact is, you can unburden them, and you will. And now we've completed 2 steps of the 3-step approach.
Now let's spend some time discussing this step. I believe that this step is a step that has always been missed, even by my very enlightened alternative medical community. Many of my colleagues who are extremely gifted in being able to deal with deficiency states and toxicity states have taught me a great deal about how to correct deficiencies and remove toxicities. But as I go to medical conferences and I'm sitting with them after the conference is concluded for the day, I've oftentimes listened to their explanations and I hear them talk very voluminously on things involving deficiencies and toxicities. And then I ask them, I say, well, hey guys and gals, what about step number 3? And they look at me and say, what do you mean, step 3? And I look at them back and I say, what do you mean? What do I mean about step number 3? And they say, well, what is it? And that's when I begin to come to an understanding on why it is that when these corrections are made in your deficiencies and toxicities, that and your vision doesn't improve, I think I now know why. It is this step, the step that even enlightened alternative doctors seem to be unaware of, that provides, I think, the key that unlocks how do you restore your lost vision. So I have come to recognize that optimizing perfusion is the missing link. It's the one thing that always gets missed. But when you include it, and you now are able to offer up a blood supply into the various tissues of the body, things begin to change that did not have the opportunity to change beforehand. What you see here, ladies and gentlemen, is a capillary network, literally the microvasculature that permeates throughout your entire body, right down to the microscopic cells that these blood vessels service. So what's depicted here might very well be a depiction of what's going on in the back of your eye, in the very retina that's not functioning quite well right now and has left you with some retinal disease that you've been told that nothing can be done about. The reason that nothing can be done, I claim, is that as you age, you're going to be decreasing the capillary network found within these tissues. And so the retina really does not have the blood flow necessary enough to bring nutrients to it and to remove waste products from it. This must be done if we are going to be successful in restoring your lost vision. And once again, a further look at this issue of optimizing perfusion.
You can take truckloads of vitamins and minerals. You can eat the most wonderful diet in the world, but you can't get a single one of those nutrients to diseased tissue because the blood flow to that tissue is all dried up. If you don't reestablish it, the best diet in the world will not, and I repeat, it will not be able to revive that tissue back to functioning again. By the same token, you can do as many colonics as you'd like. You can do liver cleanse, gallbladder cleanse, bile duct cleanse. You can cleanse your cleanse. But you won't be able to cleanse the toxic substances that are in the diseased parts of your eye because that area of the body doesn't have a blood flow at all. It is the giant cog that makes all three things together accomplish the goals and objectives that we have been able to achieve for quite some time now within the context of the 3-day program.
So the point to make here is you can actually markedly improve the perfusion to your retina, and as a result, significantly increase blood flow to it, which will help regain your lost vision.
I want you to take a moment and have an opportunity to listen to some of the testimonials given by our 3-day graduates as they have left our programs to see what they think about the Courtney 3-day program. I'll let you take a listen and love to hear what you think about them.
I'm rolling along. I come down with severe glaucoma and severe in both eyes, and the right eye was even worse than the left, and could not hardly read any lines on the vision chart. And after taking the 3-day program, I was privileged to say that I could see down to the 5th line and read it, and just amazing results. And even my left eye, the vision improved. I could get down into 20/20, and even said maybe I read some in the 20/10. Outstanding program that made a believer out of me, that anybody could gain this much with glaucoma, where I've been told that no vision would ever be gained back. And it was just a great experience, and the staff and everyone was so wonderful. We just appreciate everything that Dr. Courtney done and the staff, and this program is truly amazing. You need to try it, and man, it's overwhelming what it'll do for you.
Hello, I'm Lanny Green, and this is Melba Green, my wife. I have had a stroke, and that was near the occipital nerve, and it ended up taking half of my vision off of each eye. And also I have glaucoma, and I have really not had a lot of hope until I experienced this program here, read about, and I'm so fortunate that I joined, decided to come and experience a great improvement in my eyesight. It's been amazing, definitely measurable, both by the charts and the equipment, testing in the beginning and in the end, but also my own personal experience. I felt the difference, and I feel the difference, and of course I can see the difference. The clarity is amazing. The small letters that I can read and see now is a marked improvement. I'm really encouraged. I am very glad I participated and joined the program, and very impressed with the staff here.
I'm Melba Green, and I'm Lanny's wife, and I was ready for him to do anything that would bring hope into his life, because since his stroke he had been very depressed and not hopeful because of the information that all the specialists, MDs, optometrists, and ophthalmologists gave him. He found this program and started reading it, and we were very impressed by that, if a little doubtful that it might be true. When we got here, the staff was cheerful and welcoming. They were also energetic and organized. And the results of the 3-day intensive therapy have been astounding. Yesterday, when we walked out of here after reviewing the test, my husband's face was aglow.
I'm Sandy Paulson, and I was diagnosed with cataracts. I came to the clinic, and to be honest, from the first day to the last, it was like getting new windshield wiper blades. You know when you drive your car and you turn on the wipers and they just don't clear away all the muck, especially when you're in some dusty, dirty place, and it goes across the windshield, but it doesn't clear off the dirt. So I've been looking through that for the last 6 or 8 months, and on the last day, I mean, it was just like I got new blades in my wipers. And it's so much better. I was out taking pictures this morning and I can see so much clearer.
So ladies and gentlemen, the matter now becomes, what can you do to take charge of your vision challenge? How in fact do you start? Well, let's say there are a couple of steps to follow. First, you get a copy of the book, Restore Your Lost Vision Now, the 3-step program to regain your sight. This literally is the workbook of the 3-day program. It follows the steps just the way that we teach those steps while we are conducting the 3-day program. It is the best possible reference I can imagine to make it extremely clear without any doubt as to what the 3 steps are and how you conduct all 3. After you have the book, get started on your 3-step corrections, even at home. You can begin to correct your deficiencies. You can begin to remove your toxicities. You can also initiate the recommended supplementation to allow you to do it in the same way that we do within the context of a 3-day program. Fill out a qualifying application and request a free consultation where we can discuss your specific eye condition and the program best suited for you. There is no obligation, and the consultation is free. And it allows you the opportunity to get many of your specific questions answered. We offer 3-day treatment programs each month in our Pittsburgh, Pennsylvania, and our Zephyr Hills, Florida offices. Now I'm going to make a statement. I made it before in this webinar, and I'll be making this statement a number of times while you're deciding to come to, or in fact, once you've arrived at one of my 3-day programs. And here it is. 85 to 90% of those patients who complete a 3-day program will have a substantial improvement in their vision in 3 days. Now that's right. Head to the website and review our documented results of the various participants, many of which have your same diagnosis, and find out how they did and how substantial their improvements were. We're quite proud of our results, and in my opinion, they're not reproducible anywhere. So don't forget the free consultation, getting all your questions answered to be able to find out more. I hope that you have learned what in fact can be done about your eye condition. You only need to take charge of your situation and get things started. Restore Your Lost Vision Now, the 3-step program to regain your sight. To get a copy of the book, click here and get some answers. Thank you very much.